Hello, this is Dr. Brad Stockert again. At this point, we'd like to go over some debriefing information with you regarding the scenarios you just performed. We'll start with the baseline screen that you see here. And when you look at this particular screen, we'll go over the elements from the top to bottom. First, you'll notice that there's an average heart rate of 84 set into the machine, and that the ECG tracing gives the appearance of normal sinus rhythm. In addition, you'll notice a line for blood pressure, currently set at about 108/66 millimeters of mercury pressure. Once again, both of these variables will vary slightly over the time course. That's normal variation. The third line is the oximeter reading for oxygen saturation. Currently on the screen, the machine reads 97. Please recognize the machine was set for 98 and that 97 and 99 are normal variations around the set point of 98. There are other numbers up there at this point. We're looking at pulse numbers and body temperatures. We're not using those as part of the scenario at this point. We're now going to discuss some of the various scenarios that you were exposed to during this simulation lab. Atrial fibrillation is the erratic quivering and twitching of the atria. It is due to multiple ectopic foci in the atria. It is a sign of irritability in the atria, and as you see on the screen at this point, it gives no distinct P wave, but rather a wavy line with intermittent QRS complexes that appear relatively normal. Atrial fibrillation results in no coordination between the atria and the ventricle, and the actual heart rate of the ventricle is determined by the AV node. Since the signal passes through the AV node normally, the QRS shape may be normal, but the ventricular rhythm may be normal or abnormal. As a new finding, atrial fibrillation should be a cause to discontinue exercise. However, if atrial fibrillation is a chronic state and the heart rate's less than 100, then it has a minor effect on cardiac output and rehabilitation potential is good. If atrial fibrillation starts with the onset of exercise, there's a decrease in the cardiac output, an increased risk of symptoms, and an increased risk of an adverse event. As a result, a new finding of atrial fibrillation should be caused to discontinue physical activity at that point in time, and you should return the patient to bed. Oximetry is used to determine the number of hemoglobin sites that are bound to oxygen. Normally, the SO2 saturation is about 98 to 99%. Meaning 98 to 99% of the available oxygen sites are clearly oxygenated. You'll note on the monitor that this value frequently fluctuates 1 to 2%. However, SO2 levels are cause for concern in the following instances. Number one, a drop of 3% or more in the SO2 level is cause for concern and reason to discontinue physical activity. In addition, an SO2 level that's below 90% is cause to not continue activity or to discontinue the activity even if the drop is less than 3%. This is because there's too little oxygen carrying capacity for the brain and other vital organs, and there is an elevated risk of an adverse event. As a result, if the SO2 saturation level drops below 90% at any point in time, or the subject experiences a drop in the SO2 of 3% or more, whatever physical activity is occurring should be discontinued at this point in time. You'll note in the particular scenario you were presented that there were minor fluctuations around the initial set point of 98%. So that you might have seen anything from 96, 97 to 98 or 99. At one point in time, however, the SO2 saturation level was purposefully dropped to 96%, a 2% drop. We hope that you were able to recognize this drop in oxygen saturation, as well as recognize that this minor drop in oxygen saturation did not meet the threshold for discontinuing activity. Thus, this minor drop in SO2 saturation levels was significant but not an appropriate cutoff point for terminating physical activity. You see on the screen before you now an example of ST segment depression. I want to remind you that ST segment depression consists of a horizontal or downward sloping ST segment that's depressed for at least 1 millimeter or more and has a depressed duration of greater than 0.08 seconds, or 2 small boxes if those were on the screen. The depth and duration of depression is proportional to the degree of ischemia that the ST segment signifies. As a new finding, ST segment depression should be caused to discontinue the physical activity you're currently involved in. All of this information is based on the following assumptions. The ST segment was isoelectric at rest and became depressed during the activity. Assumption number 2. There was an absence of cardiac medication that would alter the response to testing. Such a medication would be digoxin. The third assumption is the absence of metabolic abnormalities during the testing, such as hypokalemia. If these 3 assumptions are correct, and you see a horizontal or downward sloping ST segment as a new finding, that should be caused to discontinue the activity.